The query regarding dietary consequences and chances of losing weight are also well addressed in this treatment mode.
Even though it is a very sleeve gastrectomy, we are doing a very loose sleeve gastrectomy. There won't be much restriction. So initially all these patients will lose almost 3 to 4 kgs because of the diet restriction we are doing, because these patients will be allowed to take only fluid diet for 1 or 2 weeks. Still all these anastomosis have a good, the scar will get matured. And then after that, from the 3rd week onwards, they will be start on the fluid, semi-solid diet and then the normal diet. So the initial there will be some weight loss. Otherwise, in long term, there won't be any weight loss. But if when we do the diverted ileal interposition or the DJB, we are diverting the food from the duodenum and the jejunum. So the absorption of the B complex and the especially the calcium and vitamin B1, B12, B6, this has to be reduced because of the diversion, and so we have to supplement these things along with the food for some more time. That's the only dietary consequences these patients will have. But usually these diabetes patients, after the surgery, once their blood sugar level comes normal, they can take all types of the food, including the sweet.
Depending on the criteria of case selection process, it takes usually 3 to 4 months for the blood glucose levels to be normalized and nearly 6 months for the patient to be completely out of all medication.
So when we treat this diabetes mellitus medically, it is very well proved that the A1C level, only 7% of the patients will be, the A1C level will come down to 7. Whatever the medical treatment we are taking, this is all the proved data. So the A1C level, the very surprising thing after this surgery is that the A1C level is coming down 7. That means these patients are getting a real control of the diabetes after this diabetes surgery operations.
Thus, all data generated world over so far, including the pioneering studies conducted at Maulana Hospital, Perindalmanna, bears testimony to the very fact that diabetes surgery for those really indicated patients are of immense help to them and proves to be the most effective treatment modality.
I believe the only the adverse effect or the negative factor in this operation for our Indian population is the cost of the surgery, because as we are doing this surgery laparoscopically. Why we are doing it laparoscopically? Because when we are doing this much cutting and reanastomosis, there should not be any adhesions. So that is when we do the open surgery, we know that it is very likely to get adhesions, and this patient may have a later intestinal obstruction and all. But when we do laparoscopically, the problem is that all we are doing the disposable endo staplers. So these staplers, it will cost a consumable cost a lot, almost 12 to 14 staplers, endo staplers we have to use. So almost the cost of the consumables itself, it will cost around 1.5 to 2 lakhs rupees. So that is why this surgery is very expensive, and in major cities now they are doing it from 3 to 5 lakhs rupees. In our hospital, we are doing it for 2.5 lakhs rupees, all inclusive. It is as a package. I believe that is the lowest in the country, and that includes everything, the room charges, everything that includes. So till now we have done, as I said, 9 patients, non-obese patients we have done. When you take the obese diabetes patients, almost we are closing 200 bariatric procedures we have done in last 5 years. In that, 52 patients were diabetes patients, and it is very exciting that almost all the patients are out of medicine, the obese patients. But we have to see what is the result of the non-obese patients, and if it is going to stay, I think it will revolutionize the diabetic treatment in future.
And finally, at the recently concluded World Congress on Interventional Therapies for Diabetes, the American Diabetes Association and the International Federation of Diabetes have approved surgery as a module of treatment of diabetes, even in non-obese patients with less than 35 BMI. Thus, indeed, surgery for diabetes is going to revolutionize future diabetes treatment modalities.